Today we're diving into a crucial health topic that affects millions worldwide: low blood sugar levels, also known as hypoglycemia. While it's often associated with diabetes, anyone can experience low blood sugar, and understanding the warning signs is crucial for your well-being. From subtle changes in your mood to more serious physical symptoms, recognizing these signs early on can make a world of difference in managing your health. Remember, this video is for informational purposes only and should not be considered medical advice. Now let's get started and empower you with the knowledge to take control of your health. Have you ever felt like your hands were trembling for no apparent reason? That shaky feeling can be one of the earliest signs of low blood sugar. When your blood sugar levels dip, your body is deprived of its primary energy source, glucose. This energy deficit can manifest as shakiness or trembling, particularly in your hands, but it can also affect your legs and even your voice. Shakiness can range from mild to severe depending on how low your blood sugar has dropped. You might notice it when you're trying to perform tasks that require fine motor skills, like buttoning your shirt or writing. In some cases, the shakiness can be so intense that it makes it difficult to even stand or walk. If you're experiencing sudden or unexplained shakiness, especially if it's accompanied by other symptoms like sweating or dizziness, it's essential to pay attention to your body's signals. By recognizing the warning signs of low blood sugar, you can take steps to raise your blood sugar levels and prevent more serious complications. Sweating is your body's natural cooling system, but when you find yourself drenched in perspiration without any apparent reason, it could be a red flag for low blood sugar. This excessive sweating, also known as diaphoresis, occurs because your body goes into overdrive when your blood sugar plummets. Your brain senses that your blood sugar is dangerously low and sends out an SOS signal to your adrenal glands. These glands respond by releasing a surge of hormones, including adrenaline, which increases heart rate, rapid breathing, and sweating. You might notice this excessive sweating even when you're not physically active or in a hot environment. Pay close attention to the timing of your sweats. Does it tend to happen after you've skipped a meal or engaged in strenuous exercise? If you're experiencing unexplained sweating, especially if it's accompanied by other symptoms like shakiness or dizziness, it's crucial to check your blood sugar levels or seek medical attention. Dizziness, that feeling of lightheadedness or unsteadiness, is a common symptom of low blood sugar. It occurs because your brain relies on a steady supply of glucose to function properly. When your blood sugar levels drop, your brain is one of the first organs to feel the effects. Without enough glucose, your brain cells can't communicate effectively. You might feel like the room is spinning or have difficulty maintaining your balance. In severe cases, dizziness can cause you to faint. Check your blood sugar levels and seek medical attention if necessary. We all experience hunger from time to time, but when that hunger pang strikes with a vengeance seemingly out of nowhere, it could be your body's way of sounding the alarm for low blood sugar. This intense, sudden hunger is not your typical "I could eat a snack" feeling. It's a primal urge to consume food as quickly as possible. When your blood sugar levels drop, your body releases hormones like ghrelin, often referred to as the hunger hormone, which sends a message to your brain saying, "We need fuel stat." You might find yourself craving sugary foods in particular, as your body instinctively knows that these foods will provide a quick and easy source of glucose. However, it's important to resist the urge to binge on sweets, as this can lead to a rapid spike in blood sugar, followed by an equally rapid crash. If you're experiencing sudden, intense hunger, especially if it's accompanied by other symptoms like shakiness or dizziness, it's essential to listen to your body's cues and eat something that will provide a sustained release of glucose. Ever notice you get cranky or irritable when you're hungry? It's your brain reacting to low blood sugar levels. Low blood sugar affects your mood, making you irritable, anxious, or short-tempered. You might snap at loved ones, feel overwhelmed by tasks, or experience unease. These changes can escalate quickly. Blood sugar drops disrupt brain chemicals, affecting serotonin and dopamine. Check your blood sugar if you feel shaky or dizzy. Eating a balanced meal can stabilize your mood. We all experience fatigue, but when it's persistent and overwhelming even after a good night's sleep, it could be a sign of chronically low blood sugar. This type of fatigue is a deep-seated exhaustion that can make it difficult to get through the day. When your blood sugar levels are low, your body runs on empty and your energy levels plummet. This fatigue can manifest as physical weakness, lack of motivation, and difficulty concentrating. If you're experiencing persistent fatigue, consult with your doctor to rule out any underlying conditions. Addressing blood sugar imbalances through diet, exercise, or medication can help restore your energy levels. Blurred vision, a sudden haziness that makes it difficult to see clearly, is another alarming warning sign of low blood sugar that should never be ignored. This visual disturbance occurs because your eyes, like every other organ in your body, rely on a steady supply of glucose to function properly. When your blood sugar levels drop, your eyes are deprived of the glucose they need to maintain their fluid balance and focus properly. This can lead to blurred vision, double vision, or even temporary blindness in severe cases. When your blood sugar is low, the muscles in your eyes don't receive the energy they need, and your lens can't focus properly, resulting in blurred vision. If you're experiencing sudden blurred vision, especially if it's accompanied by other symptoms like shakiness or dizziness, it's crucial to check your blood sugar levels immediately. Eating a quick source of glucose, such as a few glucose tablets or a glass of juice, can often help to restore your blood sugar levels and improve your vision. Headaches are a common ailment that can have various triggers, but when they strike suddenly and intensely, especially if you're experiencing other symptoms like shakiness or dizziness, they could be a sign of low blood sugar. These headaches, often described as throbbing or pounding, occur because your brain is starved for glucose, its primary energy source. When your blood sugar levels drop, your brain doesn't receive the glucose it needs to function properly. This can cause blood vessels in your brain to constrict and then dilate, leading to the throbbing pain associated with low blood sugar headaches. If you're experiencing sudden, intense headaches, especially if they're accompanied by other symptoms like shakiness or dizziness, it's essential to check your blood sugar levels. Eating a balanced meal or snack can often help to stabilize your blood sugar and alleviate your headache. Addressing any blood sugar imbalances through diet, exercise, or medication can help to restore your energy levels and improve your overall well-being. Confusion, a state of mental disorientation that can make it difficult to think clearly or make decisions, is a serious warning sign of low blood sugar that should never be ignored. This cognitive impairment occurs because your brain, like every other organ in your body, relies on a steady supply of glucose to function properly. When your blood sugar levels drop, your brain doesn't receive the glucose it needs to function optimally. This can lead to a range of cognitive impairments, including confusion, difficulty concentrating, and memory problems. If you're experiencing sudden confusion, especially if it's accompanied by other symptoms like shakiness or dizziness, it's essential to check your blood sugar levels immediately. Eating a quick source of glucose, such as a few glucose tablets or a glass of juice, can often help to restore your blood sugar levels and improve your cognitive function. Addressing any blood sugar imbalances through diet, exercise, or medication can help to restore your energy levels and improve your overall well-being. Seizures, sudden surges of electrical activity in the brain that can cause convulsions, loss of consciousness, and other serious symptoms, are a rare but life-threatening complication of severely low blood sugar. This extreme reaction occurs when your brain is critically deprived of glucose, its primary energy source, and can no longer function properly. Seizures are a medical emergency that requires immediate attention. If you witness someone experiencing a seizure, it's crucial to stay calm, ensure their safety by removing any nearby objects that could cause harm, and call 911 immediately. If you or someone you know experiences seizures, especially if they're accompanied by other symptoms of low blood sugar, it's essential to seek medical attention immediately. Prompt treatment is crucial to prevent further complications and ensure the best possible outcome. Low blood sugar can be a frightening experience, but by understanding the warning signs and taking prompt action, you can effectively manage this condition and prevent serious complications. Remember, knowledge is power when it comes to your health. If you experience any of the symptoms we've discussed, it's important to consult with a healthcare professional for proper diagnosis and treatment. Thank you for joining us on this journey to better understand low blood sugar levels. Stay healthy.